Welcome, everyone. My name is Kelly Avila. I work here as a nurse care coordinator. Today, we will be exploring the fundamentals of care coordination, focusing on its importance in nursing practice, ethical and policy implications, and strategies for improving patient outcomes. Effective care coordination is essential to optimizing patient care, particularly in community and primary care settings. This presentation will provide insights into best practices for collaborating with patients and families, address ethical challenges, and discussing policy factors that impact care coordination. By understanding and applying these principles, we can better support our patients and help improve the quality of care they receive. Care coordination is a process and involves organizing and managing patient care across different healthcare providers and settings to ensure that the patient receives comprehensive and continuous care. It aims to eliminate fragmented care, reduce hospital readmissions, and improve health outcomes. Nurses, being at the forefront of patient care, are crucial in facilitating communication among patients, families, and healthcare providers. Recent research underscores the importance of care coordination, especially in managing patients with complex needs. According to Quran, nursing care coordination for patients with complex healthcare needs in primary care can reduce care fragmentation and lead to a better health outcome. This highlights the crucial role of nurses in creating and maintaining cohesive care plans that follow the patient through various stages of treatment. One of the most important aspects of care coordination is definitely collaborating with patients and their families. Nurses can improve health outcomes by engaging patients in their care decisions and providing them with the knowledge they need to manage their health effectively. Let's explore key strategies for achieving this. Patient education. Nurses are responsible for ensuring that patients understand their medical conditions, medications, and treatment options. For example, in managing patients with chronic diabetes, nurses provide education on medication adherence and lifestyle changes, answering any questions. Ataya emphasizes the role of balancing confidentiality and care coordination, ensuring that patients feel comfortable and well informed about their care. Cultural competence. Understanding a patient's cultural background is definitely essential in ensuring effective communication and care coordination. Nurses must be aware of cultural norms that may impact healthcare decisions, such as dietary restrictions or preferences for certain treatments. This culture competence improves the patient's trust and promotes better care outcomes. Family involvement. Family members are often serving as caregivers and play an integral role in the patient care. Actively involving them in the care coordination process helps ensure that patients will have the support they need at home. A study by Davis found that nurse-led care coordination services for people with multi-morbidity can significantly improve their care continuity, and especially when families are included in the process. That way they all have an understanding. By utilizing these strategies, nurses help patients navigate the complex healthcare system and ensure that their needs are met both clinically and at home. Change management is a crucial aspect of care coordination, especially as healthcare systems are evolving. Nurses must adapt to new technology, systems, and practices to ensure that the patients receive high-quality care. For instance, the introduction of electronic health records, or EHRs, has improved the ability to track patient care and coordinate care across different providers. However, these changes can be challenging. Nurses need to be trained on these tools effectively while continuing to provide compassionate, patient-centered care. Managing transitions of care is an essential part of nursing practice. This is particularly important when patients are discharged from the hospital or transferred between settings. A review from Arden on the Golden Hour Care Coordination and a perinatal care highlights the importance of seamless transition to prevent complications and improve patient outcomes. Effective change management not only improves the quality of care but also enhances patient satisfaction by reducing errors and improving the patient's experience. It's already stressful. Ethical decision making is an integral part of nursing care coordination. Nursing often faces situations where they must balance patient preferences, resource constraints, and medical recommendations. For example, in some cases, a patient may choose to forego certain treatments or interventions. Nurses must respect these decisions and while ensuring that the patient fully understands the potential consequences. The ethical principles of autonomy and benefits are at the core of these decisions. Ataya discusses the ethical dilemma between maintaining patient confidentiality and ensuring coordinated care. Nurses must safeguard patient privacy while facilitating the exchange of information necessary for effective care coordination. Furthermore, nurses must advocate for equitable access to care, especially for underserved populations. This often requires navigating resource limitations and ensuring that all patients, regardless of their background, receive high-quality care. Karam notes, addressing complex care needs often requires ethical decision-making that balances care priorities and patient autonomy. By incorporating ethical reasoning into care coordination, nurses help to maintain the trust and ensure that these patients receive the best possible care. Health policies can significantly impact the way care coordination and the quality of care is provided. Nurses must be aware of relevant policy provisions and how they affect patient outcomes. For example, policies like Affordable Care Act, the ACA, have increased access to health care, which has allowed for more comprehensive care coordination, especially for individuals with chronic diseases, as noted in the study. By improving care coordination of patients with chronic diseases, care coordination models have been shown to improve patient outcomes and chronic disease management. However, policies can also present challenges. For instance, restrictions in funding or changes in insurance reimbursement can affect the availability of these services, particularly in community health centers. Davis stresses the importance of addressing multimorbidity in care coordination, but financial barriers may prevent full implementation of necessary services. So nurses must stay informed about policy changes, advocate for their patients, and work within the constraints of the healthcare system to provide the best possible care. Nurses are the cornerstone of care coordination, especially in a primary care and community setting. As the primary point of contact for patients, nurses ensure that all aspects of care are integrated and that the patients receive the right care at the right time. Whether managing transitions between providers or educating the patients and families, nurses are integral into creating a patient-centered care plan. By adopting the best practices in care coordination, nurses can improve health outcomes, reduce hospital readmissions, and ensure that patients experience seamless transitions across care settings. As highlighted by Ardern and Karam, the nurse's ability to effectively coordinate care is critical to achieving positive health outcomes for all patients. In conclusion, care coordination is an essential component for nursing practice, with a direct impact on patient outcomes. By utilizing effective communication strategies, adhering to ethical principles, and understanding the implications of health policies, nurses can enhance the quality of care delivered to their patients. The role of the nurse in coordinating care is not just about managing medical treatments, but also ensuring that patients receive holistic, patient-centered care. Thank you for your time today, and I encourage you to continue expanding your skills in the care of care coordination to improve patient outcomes and foster a more integrated healthcare system.